I'd like to invite now to the podium Raina Merchant, who is coming from the University of Pennsylvania.
Great, thank you so much. I want to first thank the committee for the invitation and for all of you for this opportunity to engage. My disclosures, I've received funding from the NIH. I have a K award looking at public reporting in cardiac arrest and an R01 looking at social media and cardiovascular health. I was asked to specifically talk about innovative technologies and their role in improving public awareness and action. There are a lot of themes that we've heard today around communication, around messaging, around connectedness, and around marketing. And I think that's where many of these innovative tools and technologies can play a role. So I wanted to start with an example of several of these innovative technologies. I was asked to sort of comment on their limitations and the opportunities in this space. And many of the things which are emerging really focus around how do we use tools for improving access. And specifically, a lot of this work is focused on access related to bystanders as well as access related to AEDs. There's a recent study in the New England Journal of Medicine which reported on findings from Stockholm, where they had an automated system that, along with the reporting from EMS, would also notify trained responders when there was a cardiac arrest event, and those people would actually go to the bystander side to respond. And so they didn't show a difference in survival outcomes, but you'll see along the top that they did show an improvement in their primary outcome, which was bystander-initiated CPR. So those in the intervention group who received this automated messaging, they were able to engage a crowd to be able to respond to these events, and they were able to show an improvement there in those initiating bystander CPR. Looking forward, in the United States, there are also similar efforts around sort of accessing bystanders and using sort of new technologies. Many of you are familiar with PulsePoint, which basically is an app that you can download on your phone. And when EMS receives a call of a likely public event with a cardiac arrest, again, in the Stockholm study, this specifically focused on trained responders. For the PulsePoint, they don't require a certification. You can just be a willing volunteer who would want to respond. And in this case, the PulsePoint app will notify you of a person who's in need of assistance, as well as, if known, where the closest AED is. And so there's been a significant kind of uptake and interest in this PulsePoint app and sort of the process of engaging sort of crowds and individuals who could respond. I think initially the idea here was that there could be someone right next door. We're all in this room, we're all ready to respond, and yet we wouldn't know that someone one classroom over was having a cardiac arrest. And so this really sort of engages and uses this power that we're all carrying cell phones to get a message, and we would be able to respond. In addition to looking at access, we wanted to look at not just accessing people, but what about these devices? So Marina opened up the session by saying where the closest AEDs were located. And so we were interested in, again, how could we use new innovative technologies to make these devices more know where their locations were. So in this case, we use mobile technology and built-in application, use crowdsourcing and gamification to engage the public to try to find where all the AEDs were in Philadelphia. Prior to this contest, we knew where 50 of the devices were that were sort of registered and logged. And we were able to locate over 1,400 of these just by asking the public to go out and take pictures of these devices and report them back. This information now is publicly available, and since this contest in 2012, there are more than 10,000 AEDs which have been reported across the state that someone can use in the event of emergency. Again, this piece isn't the actually connecting the bystanders, but I guess that's sort of where do we find these devices. Looking beyond just sort of the access, we were struck by how at the end of that contest, we were interested in how to make these devices more noticeable. And again, wanting to engage sort of social media and using crowds, you'll see that this AED looks like it's sort of standing alone, it's on a wall, it's by itself. Marina pointed out where the AEDs were, and I don't know how many people actually recognized them or noticed them when they walked into the building. And so here we used the power of the internet and asked people to design something that would go around an AED that might make it more memorable and noticeable. So I can have the location of all the AEDs I want on my phone, but if I walk into a building and I don't even notice that it's there, how can how can we sort of imprint this even further on the public? And here we had over 65,000 people who voted and went online to either make submissions or to vote on designs. And this is just an example of one of the ways that we might think about messaging. And thinking further around sort of accessing AEDs, I talked about sort of how bystanders can help with accessing AEDs, how we can crowdsource to find locations, but what about the AED just coming to you and sort of taking out the steps of you having to know and respond? There's some work that's happening where people are piloting and thinking about what if there's a drone and the AED just comes right to the side of the bystander, and thinking about how we might use sort of this just-in-time ready sort of devices. Also thinking about sort of access and public knowledge. So I direct and study social media. This was some work where we had looked at Twitter, which is publicly available. And so thinking about how could we use Twitter or other sort of sources for understanding more about what does the public actually know about cardiac arrest. We've talked a lot about messaging. One of the speakers talked about heart attack versus cardiac arrest. And so thinking about how do we use all these billion bits of data, which are regularly sort of these digital breadcrumbs that are regularly left by the public, to understand more about how the public thinks about this disease that we all really care about. And what we found is that people were posting lots of questions about what is cardiac arrest, about does anybody know CPR, why do I need to get certified, what does certification mean, questions on education and training, questions around symptoms, what does this mean I could be at risk for cardiac arrest, and a lot of sort of fact-finding and thinking about ways that we as a community could help with educating the public in that regard. And then finally, there's a recent American Heart Association scientific statement which came out in circulation last month, which really looked at many of these things around mobile devices, social media, and crowdsourcing, really as digital strategies for improving emergency cardiovascular care. So here we looked more broadly at cardiac arrest, at heart attack, and at stroke. And within this document, there's a nice table which really sort of outlines a potential research agenda and some of the directions that we could look for moving forward around thinking about how to use these innovative tools for the treatment and management of cardiac arrest. Thank you so much for your time and attention. I look forward to the questions.